I want to talk to you about something that almost no one explains properly, especially to men, and especially as we get older: foreplay. Not as a joke, not as something optional, and not as something rushed, but as a biological, neurological, and hormonal process that deeply affects arousal, performance, satisfaction, and long-term sexual health. Most people think foreplay is just a warm-up, something you do for a few minutes before getting to what they believe is the main act. But from a medical perspective, that idea is completely wrong. Foreplay is not preparation for intimacy. Foreplay is intimacy, and when it's done correctly, it changes everything: desire, erection quality, ejaculation control, emotional bonding, and even confidence. Before we begin, let me ask you one honest question. Are you truly listening to what your body needs during intimacy? If you want better connection, better control, and a healthier intimate life, you're in the right place. Like this video, subscribe to the channel, and let's talk about something most people rush, but shouldn't. Now, let's begin. As a physician, I've spoken to thousands of men who come to me worried about performance. They talk about low desire, weak erections, finishing too fast, or feeling disconnected during intimacy. And very often, they assume the problem is hormones, age, or something broken inside their body. But when we slow down and look carefully, the real issue is almost always the same: rushing the process and skipping what the body actually needs to feel aroused. Your nervous system does not respond to speed. It responds to safety, anticipation, and gradual stimulation. When you rush intimacy, your body goes straight into a goal-oriented mode. Blood flow spikes quickly, the sympathetic nervous system takes over, and ejaculation becomes harder to control. This is one of the biggest reasons men feel like they lose control too early. It's not weakness, it's biology. Foreplay works because it activates the parasympathetic nervous system, the part of your body responsible for relaxation, connection, and sustained arousal. When this system is engaged, blood flow improves naturally, sensitivity increases, and the body stays in a receptive state for much longer. This is true at any age, but it becomes especially important as men get older. One of the biggest myths I want to correct is that foreplay is mainly for women. That is not true. Foreplay is just as essential for male arousal, especially after the age of 40. Testosterone alone is not enough. Arousal depends on the brain, the nervous system, and emotional engagement. When these are stimulated slowly and intentionally, desire becomes deeper and more stable. Another important point is timing. Many men think foreplay means 2 or 3 minutes and then moving on. In reality, the body often needs 10, 15, sometimes even 20 minutes to fully transition into a state of readiness. This is not a delay. This is the body doing exactly what it's designed to do. When you allow that time, you may notice something surprising. Erections feel stronger, sensations feel richer, and the urge to rush disappears. Foreplay also plays a powerful role in ejaculation control. When arousal builds too fast, the body reaches its peak before the brain has time to regulate it. Slow stimulation allows the brain to stay connected to the body, creating awareness rather than urgency. This is one of the most effective natural ways to improve control, without medication or supplements. There is also a psychological aspect that we cannot ignore. When intimacy becomes rushed, it often feels mechanical. The mind disconnects. But when foreplay is intentional, it creates presence. Presence is what allows pleasure to expand instead of collapse into a single moment. Men who practice slowing down often report feeling more confident, more in control, and more satisfied, even outside the bedroom. I also want to talk about anticipation because anticipation is one of the most powerful stimulators of arousal. The brain responds strongly to what it expects. Foreplay is not only physical, it's verbal, emotional, and mental. A calm tone, eye contact, gentle pacing. These things signal safety and desire to the nervous system. When anticipation builds gradually, the body follows naturally. Another benefit of proper foreplay is improved connection with your partner. Many relationship issues around intimacy are not about lack of desire but lack of attunement. Slowing down creates space for awareness of your partner's responses, your own sensations, and the shared experience. This kind of connection reduces anxiety and increases trust, which directly improves arousal. From a health perspective, foreplay also supports cardiovascular function. Gradual arousal allows blood vessels to dilate smoothly instead of suddenly. This is especially important for men with mild circulation issues or performance anxiety. When the body isn't shocked into arousal, it performs more reliably. I often hear men say, I don't want to overthink it, and I understand that concern. But slowing down is not overthinking. It's allowing the body to do what it naturally does when it feels safe and unhurried. Think of it less as technique and more as pacing. When you change the pace, everything else changes automatically. Let's also address age, because many men assume foreplay matters less as they get older. In reality, it matters more. As we age, arousal becomes more context-dependent. Visual stimulation alone is often not enough. Emotional presence, touch, and timing become essential. This is not decline. This is adaptation, and when you work with it instead of against it, intimacy often becomes more satisfying than it ever was before. Foreplay also reduces pressure. When the focus shifts away from performance and toward experience, the fear of failing disappears. This alone can dramatically improve erections and endurance. Pressure activates stress hormones. Pleasure activates connection hormones like oxytocin. Foreplay is what allows that shift to happen. I want to be very clear about something important. Foreplay is not about doing more. It's about slowing down enough to feel more. Even small changes in pace can have a large impact. Taking time to breathe, to notice sensations, to stay present. These are powerful tools for sexual health. Men who consistently practice slower, more intentional foreplay often notice improvements beyond intimacy. Better sleep, reduced stress, improved mood, and greater confidence are common. This is because the nervous system learns a new pattern, one that prioritizes regulation over urgency. If you take one thing away from this, let it be this. Arousal is a process, not a switch. When you respect that process, your body responds with strength, control, and satisfaction. When you rush it, the body reacts with tension and loss of control. The choice is not about age or ability. It's about pace. So if intimacy has felt rushed, unsatisfying, or stressful, I encourage you to experiment with slowing down. Give your body the time it needs. Let anticipation build. Stay present. You may be surprised by how much changes, not just physically, but emotionally as well. Foreplay is not something extra. It is the foundation of healthy, fulfilling intimacy. And when you understand it that way, everything else begins to fall into place. If this helped you understand intimacy in a new way, let me know in the comments. Your experience matters more than you think. Like this video, share it with someone who needs this message, and stay subscribed, because real health starts with real understanding. I'll see you in the next video. Take care.